Hi everyone, today we're going to be talking about sickle cell disease. In this presentation, we're going to explain what the disease is, what it causes, how it affects patients throughout their lives, and some of the treatments and research that are currently being used to manage it. So, sickle cell disease happens because of a genetic mutation that affects hemoglobin, which is part of red blood cells that carries oxygen. It's inherited, meaning both parents have to carry the gene for a child to actually have the disease. Because of this mutation, red blood cells aren't shaped normally anymore. Instead of being round and flexible, they become stiff and crescent-shaped. These abnormal cells don't move through the blood as easily and don't carry oxygen as well. Symptoms usually start in childhood, like frequent infections, pain episodes, and slower growth. Then as the person gets older, it can start affecting organs and overall quality of life in a more serious way. Sickle cell disease is more common in people of African descent, but it also affects people from Hispanic, Middle Eastern, and Mediterranean backgrounds. It's especially common in areas where malaria used to be common because carrying the sickle cell trait actually gave some protection against malaria. In the United States, about 100,000 people have sickle cell disease. Worldwide, it affects millions of people, but a lot of them don't have access to proper health care, which makes managing the disease a lot harder. As the disease progresses, the red blood cells become stiff and can get stuck in small blood vessels. When this happens, it blocks blood flow and prevents oxygen from reaching certain parts of the body. This causes really painful episodes called sickle cell crisis. This can happen suddenly and can be very severe. Over time, repeated blockages can lead to long-term damage to organs like the lungs and kidneys. In more serious cases, it can also lead to life-threatening complications like stroke.
On this slide, we're looking at the incidence and prevalence of sickle cell disease worldwide. Sickle cell disease primarily affects populations in sub-Saharan Africa, as well as regions like India, the Middle East, and the Mediterranean. This distribution is closely linked to areas where malaria is or was historically common. Globally, about 300,000 to 400,000 babies are born with sickle cell disease each year. The highest prevalence is seen in sub-Saharan Africa, where approximately 1 to 2% of all births are affected. In the United States, around 100,000 people are living with sickle cell disease. Additionally, millions of people worldwide carry the sickle cell trait, especially in malaria endemic regions, because it offers some protection against malaria. Overall, this highlights the significant global impact of the disease and the importance of early screening and management. On this slide, we're looking at the existing prevention strategies for sickle cell disease, which are divided into primary and secondary prevention. Primary prevention focuses on reducing the risk of the disease before it occurs. This includes generic counseling for high-risk couples, which helps them understand the likelihood of passing the disease to their children. Premarital screening programs are also used in some regions to identify carriers early. In addition, prenatal diagnosis allows for early detection during pregnancy. Secondary prevention focuses on early detection and reducing complications. Newborn screening programs are essential for identifying affected infants early so that treatment can begin right away. Preventing measures such as vaccinations and prophylactic antibiotics, particularly penicillin in infants, help reduce the risk of serious infections. Overall, these prevention strategies play a critical role in improving outcomes and quality of life for individuals with sickle cell disease. Here, we're looking at the therapeutic management of sickle cell disease, which includes both pharmacological and non-pharmacological treatments. Starting with pharmacological treatments, hydroxyurea is one of the most important medications. It works by increasing fetal hemoglobin, which helps reduce sickling of red blood cells and decreases complications such as brain crisis and acute chest syndrome. Pain management is also a key component of the treatment, typically involving NSAIDs for mild pain and opioids for more severe episodes. Blood transfusion may be used in certain cases to prevent complications like a stroke and to treat severe anemia. There are also newer medications such as clinsalizumab and vexiloro, which help reduce vaso-occlusive crisis and improve hemoglobin levels. In addition, antibiotics, particularly penicillin in children, are used to prevent serious infections. Non-pharmacological treatments are equally important. Adequate hydration helps prevent sickling, and oxygen therapy may be used during acute episodes. Patients are also advised to avoid triggers such as cold exposure, dehydration, and high altitudes. Patient education plays a major role in long-term management. Lastly, a bone marrow transplant is currently the only potential cure, although it's not suitable for all patients. Treatment focuses on preventing complications, managing symptoms, and improving quality of life.
History and transition. Initially identified in 1910, researchers determined it to be a genetic disorder. Early detection via newborn screening has greatly contributed to earlier diagnosis and subsequent treatments. Advances in treatments of sickle cell disease continue today. Researchers are currently exploring potential treatments for a cure. Understanding the progression of a sickle cell disease aids in the understanding why certain treatments exist and or are utilized. Culture and social culture considerations involve systemic racism and bias, stigma and social isolation, socioeconomic factors, pain management, and cultural beliefs and alternative medicine. Strategies that can help. A culturally sensitive care, which means providing care that acknowledges but not bias. A comprehensive psychosocial assessment, a complete screening of the patient. Addressing social determinants, evaluating access to the care. Family-centered approach, involving families in the patient care. Education and advocacy, educate healthcare workers on sickle cell disease to reduce stigma and improve the quality of care.
Sickle cell disease is an autosomal recessive inherited disorder. The mutation is found in chromosome 11 in the hemoglobin beta gene. When two carrier parents of the mutated gene have children, there is a 25% chance of having a child with sickle cell disease. 50% will be carriers and 25% will be normal. Individuals who inherit two copies of the hemoglobin S will develop sickle cell disease. Around 6 months of life, as fetal hemoglobin decreases and hemoglobin S becomes dominant. Those with one copy have sickle cell trait. People who have sickle cell trait make about 60% normal hemoglobin, hemoglobin A, and 40% sickle hemoglobin, hemoglobin S. The hemoglobin S gene is found in people of African descent and to a lesser extent in people from the Middle East, the Mediterranean area, and Aboriginal tribes in India. The mutation causes a defect in the beta globin chains of the hemoglobin molecule, where the amino acid glutamic acid, which is hydrophilic, is replaced by valine, which is hydrophobic. When the red blood cell containing hemoglobin S is exposed to a deoxygenated environment, the red blood cell undergoes polymerization. It deforms and becomes rigid. Although the red blood cell can gain shape after exiting the low oxygen environment, the repeated cycles cause membrane damage and on the cell, shortening the lifespan, increasing hemolysis and causing anemia. Although disease of red blood cells at the genetic level, caused by the inheritance of the sickle cell hemoglobin gene, vascular complications are the major cause of the significant morbidity and mortality seen in sickle cell disease. Similar to diabetes, direct trauma to the endothelium is seen in sickle cell disease, arising from metabolic and hemodynamic factors. When red blood cells rupture, the hemoglobin that spills out will cause endothelial damage and inflammation. Current research. Inflammation has emerged as a central driver for vaso-occlusion, endothelial dysfunction, and organ injury in sickle cell disease. New treatments are aimed at decreasing inflammation and endothelial injury. One of those treatments is a recombinant enzyme, ADAMTS13, and is currently under clinical evaluation. The enzyme cleaves von Willebrand factor, preventing excessive platelet aggregation and blood clot formation. Recombinant human ADAMTS13 is a genetically engineered enzyme currently used for congenital thrombotic thrombocytopenia purpura, a red blood disorder. Accumulation of ultra-large von Willebrand factor has been reported in patients with sickle cell disease. This is further supported by the observation of increased von Willebrand factor antigen and decreased ADAM-TS13 von Willebrand factor antigen ratio in sickle cell disease patients at both steady state and in acute pain crisis. In humanized sickle cell disease mice treated with ADAM-TS13 show improved hypoxia and reduced systemic inflammation. Complement system dysfunction has been implicated in sickle cell disease. A monoclonal antibody treatment currently under clinical trial is crovalimab, which functions as an anti-complement C5 with the aim to reduce hemolysis. It works by blocking C5 protein of the complement system immune pathway. Inhibiting C5 protein helps to decrease hemolysis and aids during vaso-occlusive crisis. Multi-target strategies including omega-3 fatty acid supplementation are also being explored due to an anti-inflammatory, antithrombotic, and endothelial protective properties. Collectively, these emerging therapies highlight a shift toward intervention that directly address inflammation and vascular injury in sickle cell disease and may complement existing disease-modifying treatments.